This week on Unapologetic Uplift.
Really, my treatment approach as a whole has this emphasis of empowerment, where my goal is not to heal you. My goal is to help you to heal yourself. There's energy flowing through all of us at any given moment. And sometimes that energy is harnessed for good, sometimes it's harnessed for bad. And this is not in a holistic sense. I'm talking about even just in a cellular, molecular, biochemical sense. There is a piece of technology called SPECT, SPECT, that has the ability to measure the movement and flow of energy. And they have used it now for some updated studies where they can track and actually quantify and qualify what goes on during an energy healing session, the movement of energy from the practitioner to the person receiving the treatment, how the energy changes, and what happens during that process. And when you start to view this as an illness, as a disease, instead of something more mental, you realize that there's a somatic, there's a palpable quality to trauma. I've seen some really remarkable stuff, and it's amazing what the body can do once it puts down that weight that it's been carrying around, and you kind of get your life back, you get your energy back. And they've done studies, and what they have identified is that of all of the forms of energy transfer, so that would be light energy, sound energy, electric energy, electromagnetic energy, shockwave, etc., the slowest form of energy transfer is chemical, meaning that the thing that is going to work the slowest in terms of facilitating changes within our bodies is medication.
Welcome back to Unapologetic Uplift. I am your host, Kim Staples, and today I have a very special guest, Dr. Shawn Altman, who is a functional medicine expert, and he is also now stepping into energy work, or has stepped in. He's telling me he has a foot in both worlds of the non-conventional and the science world. So this is going to be a great conversation. Welcome, Dr. Shawn Altman. Why don't you go ahead and introduce yourself and share with us what it is you do and what's alive in your world right now?
Sure. So I'll be brief. My background is working with people with chronic pain and illness, trauma, physical and emotional trauma, and basically challenging populations where it's clear that the traditional treatments are not effective for those type of individuals. And I've really spent my career trying to help those individuals, but also trying to understand why. Why are they not getting better? Why is this treatment not working? Why is that one working only a little bit? And it led me to functional medicine because functional medicine has this systems-based approach of understanding how each of these individual systems interact with one another. And by understanding which systems are not working properly, you can tilt the scale, toward healing. And I really love it because both functional medicine and really my treatment approach as a whole has this emphasis of empowerment, where my goal is not to heal you. My goal is to help you to heal yourself. My goal is to help facilitate or alter some of the chemistry, biochemistry, energy within your body so that it can get to a place where it's able to complete the job. Because our bodies are very intelligently designed. They know how to heal. They know what is needed. It's just we get stuck in a particular place. And my affection for energy modalities started with, traditional energy modalities that are used in the traditional setting, things like laser therapy, photobiomodulation, red light therapy, shockwave therapy. And then I started learning more about other energy modalities. So that's FSM, which stands for frequency specific microcurrent, PEMF, pulsed electromagnetic field therapy. But as I learned those and as I tried to optimize my clinical outcomes with those, my continued quest for understanding how they work, why they work, has really led me to understand what energy medicine is and how it functions. And the fact is that there's energy flowing through all of us at any given moment. And sometimes that energy is harnessed for good, sometimes it's harnessed for bad. And this is not in a holistic sense. I'm talking about even just in a cellular, molecular, biochemical sense. And when you start to view something like trauma or illness or injury more from the lens of disease and energetic crisis, in other words, not having enough energy to heal that particular ailment, it makes a lot more sense why these modalities are so powerful. So my quest has really evolved to practicing what is called frequency specific modulation. So that is using specific frequencies of energy to use it to communicate with the body. Basically, 150 plus years of research, we've tracked and been able to reveal frequencies that are catered to certain diseases, certain tissue types, certain ailments. Some of them are generic, some of them are more general. So stuff like the solfeggio frequencies, grounding like 7.83 hertz, which is the frequency of the earth. And then some are really specific, like the anterior pituitary gland or the heart meridian or others. And we can use those frequencies to communicate with the body. We can use tools like my electrical stimulation with the FSM or PEMF, or there are skilled practitioners that do it with their own bodies. So that would be Reiki practitioners, Qigong, what are called energy healers. There is a piece of technology called SPECT, SPECT, that has the ability to measure the movement and flow of energy. And they have used it now for some updated studies where they can track and actually quantify and qualify what goes on during an energy healing session. The movement of energy from the practitioner to the person receiving the treatment, how the energy changes, and what happens during that process. And what we've discovered is that for the most part, Reiki, Qigong, like craniosacral work, those electromagnetic energies, which are very comparable to what's coming out of my PEMF device or the FSM devices, are in the 0 to 30 hertz range. And when we look at what those different numbers and values represent, most likely they are affecting change as well as providing a stimulus in terms of communication with the body. And the idea behind all of this is feedback. So we're providing the body with some sort of feedback to do, positive to do more of something, or negative to do less of something, like be less inflamed, to have the sympathetic nervous system to be less overactive. And the way feedback works is when that stimulus is repeated a certain number of times, the body learns. This is no different than learning any type of skill that might exist, skiing, bicycling, whatever. If we provide the body with the right stimulus and the right energy in the right way, it will learn to break out of these patterns. And I've seen some just amazing things, and I'm continuing to explore this territory. But I'm really, my goal is really twofold as a practitioner, as a scientist, is to, number one, raise awareness about these things being out there. And number two, to explain it more in more detail and more depth so that the credibility and honestly, like the viewpoint of these treatments changes from that of, say, alternative medicine to be more mainstream. And I think we're in a really amazing period in terms of science and technology where we can start to prove some of these things. And there are people that are starting to take notice, and social media is an excellent platform to do that.
Yeah, wow, thank you. What big, powerful work that you're doing. I have a question that keeps coming through to me, and that is, what is the difference in terms of the functional medicine and the energy work that you're doing as opposed to conventional medicine in terms of identifying the root cause?
So I'm looking for the cause of why a particular ailment or injury or illness is happening, not necessarily what the illness is. I'll give you like an illness example and an orthopedic example. The orthopedic example is probably a simpler one. So we'll take something like knee pain. Someone comes in with knee pain, their x-rays reveal arthritis. that is a given. As we get older, there's wear and tear on our joints. The arthritis progresses. We get less cushioning between our joints. But the question is the arthritis the cause of their problem, or is it just part of the terrain?
Right.
That particular individual, let's say I take a look at them, I do a physical exam, I review their imaging. In my office, I do ultrasound imaging, so, dynamic imaging of what the knee does at various angles and perspectives. And then the imaging, let's say that reveals that they have a meniscus tear and a ligament strain. So now we've realized that it's not arthritis, there's an underlying injury, and that injury is causing their pain. And then traditional medicine would probably stop there. But functional medicine, I would be looking at, okay, why did that injury happen? Did that injury happen because they were in a traumatic car accident? Or did it happen because there's some sort of muscle or alignment imbalance that puts excess torque on the knee that is causing that problem? So, perfect example would be that meniscus tear. Let's say it's a medial meniscus tear, so that's on the inside of the knee. That could be root cause related to limited hip mobility. So if their hip doesn't rotate enough, that would put a rotational torque on the knee, and that rotational torque puts more strain on the meniscus and leads to a result of an ultimate meniscus tear. So to treat that patient from the lens of, say, functional medicine, that would involve restoring hip mobility, promoting the right alignment, improving the musculature, hip, knee, ankle, the whole chain, and then also getting the knee to heal. And now when that person is done with their therapy, they're healed, not only are they better now, the likelihood of this ever happening again is very, very low because we've addressed all of the factors that led to it.
Right, right. And how do you determine if there's an energetic imbalance and somebody needs to have the energy work that you're doing, or is that something that you add to
So I add
everybody
to
that you're
it in the
treating?
sense of helping with the healing process, but stuff like that will reveal itself by their medical history, their presentation, their other factors going on. It could even be like, for instance, like the quality of inflammation, the type of inflammation that they have in the knee joint. Something that I'll often pick up on is, like, say, autoimmune disease. Autoimmune disease is characterized very often by what we call synovitis. So that would be increased synovial fluid in the joint. That's not a typical response to an injury in the joint. Usually people will have less synovial fluid. It'll get sucked up. If they have increased synovial fluid, now we know that there's more to it than just a simple injury. And then, of course, as part of the overall exam, I'm asking about things like, illness history, how gut function, sleep, more general things that allude to energetic issues. And yeah, gut and sleep are a big one. So if we're talking about, like I said, I was going to give an infectious one. So one of the things that I've been working with for really the longest period of time is Lyme disease. There's a lot of Lyme. I live in Fairfield County in Stamford area, and I grew up in Westchester County in New York, and we have the most densely concentrated cases of Lyme disease in this particular area. So it's a hotbed, and they are challenging patients to treat because the Lyme and the chronic autoimmune nature of it interferes with the ability to heal and with many other processes. But the reality of it is that the reason that they have persistent Lyme infections is because of some underlying issue energetically. Their immune system is not functioning optimally. It's not able to fight off that virus, and therefore the virus is able to continue living on and having that parasitic relationship with the body. So, yeah, I look for all of these kind of holes within these systems that we can repair and get the whole body functioning properly. And I'm not at all afraid to work with other providers or collaborate, because I'm not always able to offer everything that someone needs. My goal is to take as wide of a view to identify what issues, what problems exist energetically in terms of biochemically, mitochondrially, or other structurally, and then to come up with a game plan on how to address all of those. I try to have the tools to address a lot of them, but if I don't have the particular tools, my goal is to have someone that I work with closely that can. One of my close friends who's a naturopath, who I would say really inspired a lot of this journey that I'm on. When I first met him, he walked me into his office and he was starting a new evaluation with a patient. And he said something that really stuck with me, which I think has really inspired the journey. This particular woman came in. She had this folder of files that was probably yay thick, maybe 300 pages worth of medical history. Very complicated patient. When he looked at the files and started reviewing him and all of that, and he looked at her and he said, today's the initial consultation. I want to find out as much as I can about you. We're going to explore this. We're going to figure out what's wrong with you. And he said, I can't guarantee you that I'm going to figure it all out today, but I know where to find the answers. And we will find it. We will figure it out.
Yeah, I love that.
And that's really the approach that I try to take with every patient, is to continue exploring, to view symptoms as signals, to look at the big picture, and to find ways to help them to help themselves. And sometimes it's quick. There are certainly simpler patients, and then others are not as quick. But I am really trying to reconcile the energy medicine with science and trying to do it in a more precise way, and even just in a way that can prove the merit and the efficacy of these interventions.
Sure. Yeah. So that actually leads me to wonder, what role, if any, does intuition play in your work as a doctor and practitioner?
I think it plays a huge role. For me, intuition, I think you can't quantify or qualify intuition, but there's definitely a sense that you can get from patients in terms of when they're talking about things that are going on, what is happening, where you start to pick up on symptoms or, important clues. I have a close friend of mine who's a massage therapist, and she likes to say the mystery is in the history. So there's definitely things that we pick up on, I think consciously, subconsciously. And then I think some of it is also, there's a scientific backing behind it, because some of it is repetition and pattern recognition. Someone is relaying a story and a set of symptoms, and that story and those set of symptoms, they fit a particular type of thing that you've seen multiple times before, and you sort of just realize that you're in the, they fall into that category of autoimmune or trauma or dysautonomia or et cetera. When some people call that intuition, but then, like I said, there's some of it is just recognizing that they fit a particular pattern.
Sure.
And then it's somewhere in between. And what I've really learned in terms of that, the mystery is in the history, is that you have to develop a rapport with your patients where they're able to be open with you, because if they're holding back, if there are things under the surface that are not coming out, there could be like the most important clue to solving their current troubles. And if you're not able to get them to tell you that clue, you're going to just hit a wall. You're going to hit a plateau where you can't get beyond it, because you don't know that there's something else going on under the surface.
Right.
So, I really try to lead with that theme. Like my friend had said, we're going to uncover this together. It's a process, and I need people to be open with me, because the more they share, the more I can help.
Yeah, totally. So it's a very humanistic approach amongst all the science and everything else. So you talked about healing trauma, helping people heal trauma. What are some of the most common physical symptoms that you're seeing as a result of unresolved trauma in your practice?
So the physical symptoms I see are muscle guarding, difficulty with heart rate, blood pressure regulation, increased heat, running hot, sweating, things that signify overactivation of the sympathetic nervous system. But it goes deeper than that. In many of these trauma patients, their blood profiles are altered. Their cortisol levels are increased. There are like markers in terms of their hormones that are changed. And when you start to view this as an illness, as a disease, instead of something more mental, you realize that there's a somatic, there's a palpable quality to trauma. With a lot of these patients, there's typically an injury history. So for me, it's unraveling those injuries, knowing, is the muscle guarding due to the trauma, or is it a protective muscle guarding that's protecting an injury? Sometimes I work with a lot of patients with headaches, neck pain, upper cervical issues, instability in the upper cervical area. And basically, their neck tension, jaw tension sometimes is because their body's protecting the upper cervical spine, which is right by the brainstem and the spinal cord. And it's doing it because it doesn't want there to be too much pressure on those areas, or else it could create pain or, God forbid, respiratory or brain compromise. So finding out if there's an underlying structural issue, addressing that first. What's really interesting is that in a lot of cases, once you address something like that, a lot of the muscle tension will actually dissipate on its own. Because as I said, the body's intelligent. It knows where it's trying to get. It just sometimes there's something in the way. And then from a more nervous system or endocrine neuro type of view of trauma, I try to use these energy medicine feedback models to try to teach their bodies to re-regulate their hormones, their cortisol, their epinephrine levels, etc. And it's really about, I use the term recalibrating. So
Yeah.
it's not about increasing parasympathetic function. It's not about decreasing sympathetic function. It's about balancing all of these systems together. There isn't a brute force way to do this. It should be more nuanced, more gentle. It should be just getting kind of like fine tuning the dial on the radio. You don't need to blast the volume high or blast it low. You just need to tweak it so that they find that balance. They find that homeostasis. So that's really what we try to accomplish in my office, is to re-regulate those systems. And in the process of doing that, their body will physically, emotionally, chemically process those past traumas. And it can be quite powerful. In significant cases, I will make sure that we do it in conjunction with therapeutic partners like energy providers, psychotherapists, etc., to make sure that they're supported through that process.
Amazing.
But it is quite interesting. I've seen some really remarkable stuff, and it's amazing what the body can do once it puts down that weight that it's been carrying around, and you kind of get your life back, you get your energy back.
Totally. Have you seen a correlation between dysregulated nervous system, unresolved trauma, and the autoimmune issues?
Yes, absolutely. Yeah. I would say that that propensity toward trauma probably increases the risk of developing an autoimmune issue. There's two ways that autoimmune issues can occur. We know that there are certain genes that can trigger an autoimmune disease, and genetic expression is what we call epigenetic. So about 90% of our genetic expression is dictated by our environment. That's what epigenetics is about. So if we have a traumatic history, traumatic past, increased cortisol, increased nervous system activity, now our immune system is compromised. Now our body is less capable of turning off or avoiding turning on those autoimmune genes. And now that can trigger an autoimmune gene. And then the other way we can develop autoimmunity is just by having a chronic resistant viral infection, like something like Lyme disease. And in the same vein, if your immune system is compromised because your nervous system is hijacking all of your energy, it's not going to be able to effectively fight off a Lyme disease, mono, Epstein-Barr, COVID, long COVID, we're now working a lot with, and that's going to lead to autoimmunity. It's going to lead to a chronic autoimmune situation.
Sure. What is your take on people not just healing physically, energetically, but mentally, spiritually, emotionally as well?
I think it's really important. As I said earlier, all of these systems work together. They're all interactive. And the more efficiently each of them individually are working, the easier it is for the body to heal and to move forward. A good example, I think a lot of this comes down to just perspectives. People rave about eating clean and particular diets and avoiding GMOs and all that. And often they'll say that diet fixed their GI issue, fix this, fix that. And I want people to realize it actually was not the diet. What the diet did was it made it easier for the gut to repair itself. It took some of the weight off of the body. It made regular digestion easier and therefore freed up energy, freed up resources so that the body could repair the gut lining. It could rebalance, recalibrate the microbiome, various bacterium that exists within our gut. But again, it's you doing it. It's not the diet. It's not the supplements. These are tools to put the body in a position where it can get better, where it can heal. And when you start viewing the body that way, it makes you feel like you're in a lot more control, and it makes you feel like you can be helpful instead of helpless.
Yeah, I love that. Body is such a miraculous self-healing mechanism. So if you could recommend one daily practice that somebody could do to optimize their health and vitality, what would that be?
I would say probably in terms of something you can do yourself without instruction or anything, the most important thing is sleep. Having a quality sleep routine, getting good quality sleep. That's the restorative phase of every day. And if you're not getting good sleep, it really significantly impairs the body's ability to heal from anything. And that just alone can develop energetic crises. Think of your body like a battery that needs to recharge. Well, if the charging mechanism is not working properly, say the plug is slightly unplugged, or you don't plug in the charger long enough, each day you're starting off at less than 100%. And that over the course of weeks, months, etc., that deficit grows, and now everything becomes harder. So sleep is probably if you had to focus on one thing first, optimizing your sleep can move the needle in a million ways. And then the second thing, and this is something I teach as part of my practice, is grounding. So you can actually teach yourself to practice grounding. Grounding is basically connecting your body to 7.83 hertz, which is the electromagnetic pull of the earth. Energy healers, they do it, they live in that space. But the rest of us individuals, we don't necessarily feel energy like healers do. So I try to use the instruments I have to teach people to feel energy and to concentrate on that pulse, that, cadence of the earth. And by doing that, studies have shown that can have profound effects on nervous system regulation, heart rate, blood pressure, anxiety, stress. So it's a practice I teach people to do daily, and even during times of peak stress, because it's a way to kind of control the way energy is flowing through your body so that it doesn't, it's not out of control. When you're able to harness it more and you're able to just slow your body down, because sometimes we need that. Sometimes in our fast-paced life, in this world that we're living in, we're go, 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 we're all on the go, and we can't slow ourselves down. We can't get our body to just feel the moment, enjoy the moment, slow down.
Yeah. So help me understand what it is you're using to help people learn to notice and feel energy. Because this is something that I do with people too, not with tools, as using.
Your hands. Yeah. So I'm basically using electromagnetic energy, either PEMF or FSM, that is tuned to that 7.83 hertz frequency. And then I have them doing exercises where they're pushing into the ground while the frequency is running in order to connect the mind and the body to that stimulus.
Very cool.
It's kind of like a shortcut or set of training wheels for the uninitiated. And, it's remarkable. I love seeing the initial response that someone will have when they first feel electromagnetic energy, and they're like,
Right.
whoa, oh my God, this is like, I feel it. There's something there. And, and it's pretty amazing. And my quest to try to teach people in this, or just even harness it more, started when one of my best friends is a master Japanese Reiki practitioner, trained for 15 years in Japan, and was just amazing what he can do. And he attuned me. And during the attunement, I started to sense and feel and understand energy a lot more and feel it. And I was like, well, more people should be able to feel this, not to use it as a treatment, but just to have more control over the energy that's going in and out of their body.
Yeah, totally. And an exercise that I will often do with people is teach them how to channel energy throughout their body, because we all can do this very easily. Where attention goes, energy flows, right? So I'll just do something simple like close your eyes and put all of your awareness into your hands and focus on all of your consciousness going into your hands, all of your consciousness going into your hands. And the same thing when they feel that, they're like, oh my God, it's like a tingling, electrical zaps.
Yeah.
Pulsing? What's going on? Right. But yeah, I think it's incredible that there are tools that people can use as well if they aren't an energy healer, or we can all be energy healers if we put in the time and effort to learn how to do it and have the right mentors and teachers. But we all need energy healing. So however we can access it is incredible. And I just think it's so cool that you have
And
tools
I'll
that you're
and I'll leave you
using.
with one thought, which is actually from a research study, because as I said, all of this is scientific that I'm trying to. So there's a neurobiologist out of Columbia. His name's Dr. Martin Picard, and he is an expert on mitochondria. He's an expert on cellular energy. And they've done studies, and what they have identified is that of all of the forms of energy transfer, so that would be light energy, sound energy, electric energy, electromagnetic energy, shockwave, etc., the slowest form of energy transfer is chemical, by far,
Wow.
by like a
Yeah.
factor of 10, meaning that the thing that is going to work the slowest in terms of facilitating changes within our bodies is something like a medication. And I think we kind of intuitively know that. But again, this is emblematic of the type of stuff that I'm trying to get out there, which is bridging the science and the energy worlds and proving why energy healing might work considerably faster than going on a specific medication or doing a drug trial or injections or
Right.
surgery, be it whatever, because the science proves it. It's not as effective and it is slower.
And goosebumps as you say that, because I know this to be true based on my own lived experience. I struggled with mental health for many, many years, dysregulated nervous system, and was written prescriptions constantly. At one point, I was on 4 different psych medications, and it was coming back to my body, regulating my nervous system, and the energy healing that allowed me to walk away from medicine, which leads me into wanting to talk about how the pharmaceutical companies fund medical research. But I just want to say I have a deep, deep appreciation for the work you're doing as a doctor and scientist, because it is so needed, because the pharmaceutical companies fund medical research. We need people like you that are doing their own research and have the credentials to back it. I think it's a big deal. And I just want to say thank you, because the world definitely needs more doctors like Dr. Shawn Altman. And if it's okay with you, I would love to just ask one final question.
Sure.
And that is, what is one thing you will never apologize for?
I will never apologize for asking questions. That has really inspired my entire career in terms of growth in medicine in healthcare, in energy healing, is asking why this happens, why is this going on, how I'm a firm believer that questioning and debating and dialogue leads to greater understanding and leads to improvements in practice and in outcomes. And it's something that has made my career and my home life, that you could thank my wife too, challenging at many times because of the criticism and things that I've had to battle, and I still do. But I just remind myself of the importance of the work I'm doing and the benefits that people are getting out of it, and that just keeps me going.
I love it. Truth seeker and cycle breaker. So you absolutely fit in the unapologetic uplift world. Thank you so, so much for taking the time to be with us and share your wisdom and work.
My
It
pleasure.
was so great to have you. And for those of you that actually, before we hop off, what is the best way for people to find you if they are interested in learning more?
So you can look on my website at drshawnaltman.com. There's more information on the Altman method, which is the way that I approach both diagnosis and treatment. And there's ways to contact me on there. And then I've tried to provide maybe a little bit too much information, but a lot of quality material on there, reading material, references, things to learn. Because I want people to learn how their body works and to feel like they're more in control of the things that are going on.
Yeah, what a great way to empower people. Thank you. And anybody that enjoyed this episode, please feel free to take a screenshot, tag us in your stories, leave us a 5-star review, and share us with a friend. Take care. We'll see you next week.